Hey, there I am. Okay, now where are all of you? You're not here, so let me tell you that I'm here, and then we can all be here. And life is good. So, all right, very good. So here we are. Hi. And it's been over a week, and I know I said Saturday, and I lied, obviously, but sorry. Life happened, and that's just the way things are. So, deal. Have my one of a couple Wonder Woman mugs, but I'm right-handed, but this is like the front, which is super awesome. But then I have to hold it with my left hand, and it's counterintuitive, and then I might spill, and who knows. So here we are with birth control. Like, why is birth control so confusing? A lot of people have issues with it. They can't find the right one. They don't like it. It messes with their hormones and da-da-da-da-da. So I thought it would be helpful to have anyone ask me questions, and I can start with some of the basics. The way that I talk to people about birth control is starting with the most effective methods. And so those methods are, of course, sterilization. And let me preface that with no method is perfect. That means not even sterilization prevents 100% of pregnancies 100% of the time. That's just nature, folks. So you can do all of the things right and still end up with an unwanted, unplanned, undesired pregnancy, and that sucks. Super big time sucks. But until we can develop a perfect method, this is what we're dealing with. I don't think abstinence is the perfect method because we're human beings, and many of us fall on a non-asexual part of the sexuality scale. So abstinence works for folks who are asexual, but most people are somewhere else on that spectrum. Heterosexual, bisexual, homosexual, all of the things in between, pansexuals, the other opposite end of the asexual, right? So we're sexual beings. That's what human beings are. And that is part of our biology fact. So sorry. We don't have sex to procreate. That happens sometimes after we have sex, but we have sex to bond, to release hormones that improve social interactions, that reduce stress levels. So all that abstinence stuff isn't scientifically sound. So sterilization, top of the list, is not reversible. So don't go into having a sterilization procedure thinking, oh, I can just get it reversed. That's not how you're supposed to kind of think about it. If you want to be sterilized, great, but know that that's a decision you should be making with the thought of this is forever and ever and ever. Okay. Still over 99% effective, but less than 100% effective. The other methods that are reversible, so you can go back to being fertile when using them, and that are equally as effective as sterilization, are the IUDs and the implant. Those are, you get the same amount of protection against unwanted pregnancy. But again, the benefit there with those methods is that they are reversible. So you can return to being as fertile as you ever were. And that's how I counsel patients. Because sometimes people start using a birth control method and they've never had kids. And then they stop using the birth control method, but they're having problems getting pregnant. And then they say, oh, it was the birth control. That's not how that works necessarily. It's not, at least for those methods. There can be a delay in return to fertility, but it doesn't, the birth control methods don't cause infertility. Any difficulty resuming fertility after using one of the IUDs or the implant, that was there before using those methods because they do not affect fertility. So that's another bonus, is that once you stop using either the IUDs or the implant, then you get back to being as fertile as you ever were right away. There's no delay there. The IUDs, there's a hormonal IUD and a non-hormonal IUD. And with the hormonal IUD, they have various kinds now with various years of use. And so I won't go into all that, but just know that the mechanism of action there, how they work, is they thicken the cervical mucus and make a blockage so that sperm can't get to the egg that has ovulated. So they work differently than the birth control pills. They also thin the uterine lining, which means that you may not have a period. That's a bonus as far as I'm concerned. So that's a nice side effect / how it works. But it doesn't prevent ovulation, and they don't necessarily prevent implantation. You can argue with any sort of foreign object in the uterus, implantation could be affected, I guess, yes, but once a pregnancy is implanted, it's inside the wall and not in the cavity. And so an implanted pregnancy won't be affected by an IUD. The non-hormonal one, the copper one, kills sperm. So again, sort of doesn't let the sperm get to the egg mechanism. The implant is one of those funky ones. There's essentially a 33% chance that you'll have a change in your bleeding pattern. So a third of women have, well, I guess 2/3 chance, right? 66% chance you could have a change. 2/3 of women, 1/3 of women do not have a change in their period. A third have lighter periods, and a third have some irregularities going on with their periods, whatever that means. So there's a chance you could have improvement, a good chance. And usually, though, the reason people stop using the implant is for bleeding issues. Those are unpredictable. They can be treated. Sometimes I'll add a birth control pill to help with any bleeding issues instead of taking the implant out right away. That's the one that goes in the arm, right? But so I'll try everything aside from removing the implant. But if the bleeding is bothersome, then yeah, it's time to take it out. Of note with the implant, it prevents ovulation. So much the same way that birth control pills and other methods can inhibit the brain from telling the ovary to make an egg. That's how the implant works. It can also affect the uterine lining through similar mechanisms. So it can make it thinner, it can make it unstable, and that's why you can have these irregular spotting, or you can have a lighter to no period as well. So that could be nice. But basically what I tell people with the implant when I place it and how I counsel them is, because I'm trained in being a teacher of placing the implant, so I have to know the ins and outs. Whatever's going on at 3 months is what will happen for the lifetime, which is 3 years of the implant. And so if something's going on and we can't fix it and it's 3 months, then we take it out. No one should be held captive to their birth control method. That said, these methods are also the most expensive. With the changes under our most recent president and the Department of Health and Human Services wording, these methods are not necessarily guaranteed coverage under insurance anymore. President Obama's Affordable Care Act had ensured their coverage. That has changed because now contraception is not viewed as a preventive care. Regardless of what the president says, it is preventive care because it prevents pregnancy when people don't want to be pregnant. So it's unfortunate that that's the case. I've found that a lot of insurances still do provide coverage, but the access to these awesome methods is politically hindered, and that should not be the case. Whoever wants to have a highly effective and reversible method to prevent pregnancy until such time as they want to become pregnant should be available to everyone, regardless of ability to pay, regardless of anything, really. I mean, that's just, we have the technology. We want healthy pregnancies. We want people to be able to take care of their children. This is a greater good. So I think the Department of Health and Human Services did a very severe harm by declaring that contraception was not a preventive, it was not part of a preventive healthcare measure, because it absolutely is. Much like vaccinations, much like screenings, annual exams, all of that. It is preventive care. It prevents undesired health outcomes, but undesired health conditions like pregnancy that risks adverse health outcomes. So by every definition, it is preventive healthcare. I'll step off my soapbox. So the other methods, I'm not seeing questions, so I'm just going to keep rambling until somebody interrupts me with a question. That said, I could check Twitter to see if there are any questions. The next most most effective method is the Depo shot, the progesterone shot, the injection method. It is called Depo-Provera. That is a progesterone shot. So people who can't have estrogen, this is a great method, because much like the IUDs and the implant, it does not contain estrogen. It is progesterone only. And so this is a highly effective, great method for people. It does require the patient to go in every 3 months to get an injection, but overall a great method in the long run. A lot of people have questions about bone health, and if you have to stop using Depo after a certain number of years. The answer is no. Any effect on calcium or bone health is no different than, say, breastfeeding, and is equally reversible, just like the bone changes that happen with breastfeeding are also reversible. So it's not detrimental, it is not dangerous, and it's not bad for bone health. And when you stop using it, doesn't matter how long you've used it for, whatever effect it may have had, and again, minimal, is reversed. And PrEP is too expensive and should be covered. Yes, that is true. And we are getting there. I think that is another example of pharmaceutical companies using patent law to drive the market and make big bucks at the expense of people's lives. I absolutely agree. And I think that, when we can improve people's health care, when we can improve people's overall well-being, be it because they got screened for diabetes and it was caught early, and so they were able to make changes before their health got really bad, and then they were admitted to the hospital and needed a heart bypass and all the right? Pardon me. So I think that there's, just like with anything, when you can treat someone with HIV and lower their viral load and improve their CD4 count, their immune system, you're naturally helping. And that was heart, not PrEP. So heart is another example of cocktails of drugs that help people prolong their lives living with HIV. PrEP is to help prevent HIV transmission. When you have discordant partners, especially, you want to make sure that the HIV negative partner is on PrEP. HIV positive partner has access to heart medications, the highly active antiretroviral treatment medications. These help people maintain healthy lifestyles. That's what we all want. And then they don't get hospitalized, and they don't get really, really sick, and they don't need to take a gazillion medications. And so if we can make these treatments more affordable, because it's the right thing to do, because healthcare is a right and not a privilege, yeah, I think we need to be aware of pharmaceutical companies and insurance companies dare I say, hospital administrations, because they all get contracted with insurance companies, and make sure we keep an eye on what's going on there. That's part of what has been kind of difficult for me in being in medicine, is that I see all of this sort of money grabbing going on, and that's not right. That's not why we go into healthcare. That's not what it should be about. It used to be that hospitals were invested in taking care of people, and now it's like, yeah, we want to take care of people, but we have a bottom line that we have to protect as well. And while I understand that, there's a balance, and I feel like the balance isn't quite there as of recently. Why does our healthcare system cost so much when other developed nations don't have the issues of healthcare costs that we do? I mean, these are things we need to think about. I don't want my tea to get cold. But yeah, good point about PrEP. PrEP is, again, to help prevent acquisition of HIV, and the HAART, heart treatment, is for treatment of those who have HIV. Birth control, right, birth control, that's what I'm here. So a lot of people have problems with the pill, and I say the pill. PrEP has that cool commercial now. It's like, I'm on the pill, and it's a guy, and it's like, wait, huh? So they're reclaiming the pill because there are many pills. It's silly that we call birth control pills the pill, but okay. So birth control pills, oral contraceptive pills, come in two forms, right? Essentially, combined and progesterone only. Let me just tell you, I don't like progesterone only. I don't like it. Not the pill form. The pill form is processed in the body very quickly. You have to take the pill, the progesterone only pill, at the same time every day because of how your body processes it, and then gets rid of it. And so if you miss a pill or miss an hour, then you're at risk for an unplanned pregnancy. That's not good. That's too much. There's no room for error, and humans are prone to error. So I don't like that pill. Now the progesterone only methods, the IUDs and the implants, those are awesome because they are not prone to human error. They have very, very little to do with human error, actually, so that helps their efficacy. The combined pills with estrogen and progesterone, people have a lot of problems with sometimes, I guess, when they take them. You got to be careful with these because you want to make sure that you are able to tell the doctor what's going on, what the issues are, because essentially two things usually happen. One, there's a bleeding issue. So you're bleeding too much, you're spotting intermittently, there's something going on with your bleeding. That's one thing. The other thing is it's something else that's not bleeding. Okay, so let me explain. So the bleeding issue, that has to do with the estrogen part of the birth control pill. The estrogen part of the pill can come in various doses. So if it's a bleeding issue, your doctor should be changing you to a pill that has a different estrogen dose, because that's where the problem is. Bleeding problems, it's the estrogen part of the pill, estradiol. Other problems with the pill, mood swings, acne, hair growth, those sorts of things, all the non-bleeding issues, that's the progesterone component. Now, and this is how I talk to my patients. There are like 200 different kinds of birth control pills. No, there are 200 different brands named dispensing of pills. There are essentially 4 different kinds, and that's all due to the progesterone type, the type of progesterone that the pill uses. And so if my patient comes in and says, I'm having this issue, and it's one of those non-bleeding issues, I'm going to look up and say, well, you're on this pill. This type of progesterone is actually going to be better, so let's put you on this pill instead. So it doesn't have to be, like shooting in the dark. Like, you don't have to do that. If you know what the problem is, what the complaint is, you can adjust and change it to the appropriate pill based on what the issue is. So you're not like just throwing this pill at them and throwing that pill at them. And people get frustrated, and rightly so, because it's frustrating to try something different, but lo and behold, it's not actually different because the prescriber didn't check the type of progesterone, and you're dealing with the same issues, but it's a different pill. So why isn't it working? Well, it's not working because it wasn't changed correctly. Anyway, so the pill can be good. It is 80 to 90% effective at preventing pregnancy with typical use, over 90% effective with perfect use. I haven't met a perfect person yet in my lifetime. It's not that they're not out there, but let's be honest, there's no such thing as a perfect person. So I always use the typical use because that is typical, that is common, that is what people are prone to do. And it's not as efficacious as the IUD or the implant. It's a little easier to access, but it is something that you have to remember to take every day. It's not my favorite method for obvious reasons. Cass, been on various forms of birth control off and on since 16. Yep, stopped using Depo after 2 years and now back on the pill. Hair was thinned so much since high school. Yeah, terrified of getting pregnant. Me too. Totally terrified of getting pregnant. What should you do? First, I would check your thyroid if that hasn't been checked. Thinning hair sometimes doesn't have to do with your reproductive hormones. So I might recommend that. There are plenty of options for you. I hope that, people are different about IUDs and implants, but those are the most effective methods. I do get people who say, "Oh, put the implant in my arm because I can't even deal with something inside my uterus." It's like, okay. Other people are like, yeah, give me the IUD because, having something right here that I can feel, that's weird. So everybody's different. If you didn't like Depo for whatever reason, then probably don't do Depo. The pill is cumbersome, like I just said. So for you, if you don't have any qualms about an IUD or an implant, those would be the ones that I would recommend. And I would recommend probably the hormonal IUD over the non-hormonal, over the copper, just because the copper one can have your periods kind of heavier and crampier. Although the efficacy is the same as far as protecting against undesired pregnancy. So that's what I would recommend. And so, yeah. No problem. You're welcome. So yeah, people are different, like you just said. So if you prefer something in your arm, awesome, do that. If you do run into bleeding problems with the implant once it's placed, give it a minute, because the first couple of weeks you probably will have spotting and weird stuff. But if at 3 months something's going on, let your doctor know. Say, look, this is what's happening. They can add a birth control pill on top of it just to sort of quash whatever's going on. And then you stop the birth control pill, because obviously the point is to have just the implant. But don't be held hostage to it if you don't like it. My guess is that you're going to like it as long as there's no like weird bleeding stuff that you don't like going on. So it's overall a pretty great method. And you're welcome. See, that's what this is why I do this. So you can ask me questions. And I can hopefully answer them. So, and let me just check back in Twitter. I've gone to, this is why I do things structured. Top methods. Then we got the Depo, and this is kind of in between. We got the the ring and the patch, right? So the ring and the patch, no, people just being funny on Twitter. Funny, we'll call it that. The ring is great because it is something that you'd have to think about every day. You change it every month, and it works the same way as the birth control pill. It stops ovulation so that there's no egg to ever get fertilized. Side effects are a lot less just because you don't have to digest it in your stomach and your intestines. It's absorbed through the vaginal mucosa. You can take the ring out for up to 3 hours at a time. So if it weirds you or your partner out during intercourse, if you're having penis and vagina sex and you want to take it out, go ahead, take it out, rinse it, put it on the nightstand up to 3 hours. It's fine. Throw it back in. Good to go. If you do leave it in during intercourse, make sure it's still in after intercourse. So that's a thing. So that's a great method. And so the packaging says, and the instructions say, put it in for 3 weeks, take it out for a week, bleed, and then put a new one in. You don't have to do that. Birth control pills were designed by men who thought that women wanted to bleed every month. You don't have to bleed every month if you don't want to. That is not a thing that needs to happen. The reason it doesn't need to happen is because the birth control pills or the ring, what they're doing is they're altering your brain and your ovary talking to each other, and that's going to affect your uterine lining. And so you're not going to need to evacuate or slough off any of your uterine lining because generally these methods don't allow a lining to build up. So because you're manipulating chemically the body's natural physiology, the natural physiology also doesn't need to happen because you're taking over its naturalness anyway. Long story short, you can use the pill to avoid a period. You don't have to have a period with a pill. You don't have to bleed. If you're on the pill, you can just skip the sugar pill week and go to the next active medication, medicine involving pill of the next month. You can do that. You can do the same thing with the ring. You can leave it in for 4 weeks. That's what I would recommend, is leaving it in for 4 weeks because it's been shown that it is effective during 4 weeks' time, and then just put a new ring in. Don't take it out, leave it for a week so that you bleed. Who wants to do that? Nobody. So these are all very safe things to do. And Cass, the thyroid is in control of a lot of different things in the body. So I can't say no, but it would just be one of those things like, yeah, just have your thyroid checked. If you've never had it checked, it's a good thing. And your doctor will ask you different questions, and they may be pointing to thyroid condition or they may not. But I would just say it's one of those, it's a gland in our body that has an effect on a lot of different body systems. So it's a good thing to get checked. How do I feel about state family forcing birth control for the drug addicted? I don't know what MRDD is, foster kids and supposedly. So this is a good time to answer. Any reproductive coercion is bad, right? That said, those who are incapacitated, unable to make their own decisions, and have fertility that maybe they don't want or is dangerous for them, I mean, you have to take it a case-by-case basis. I've had parents very concerned about their daughter, being at risk of sexual assault, and so wanted to protect her against from possibly getting pregnant if there were an assault. And I think that's a valid concern. I think that's a valid reason to protect against an unwanted pregnancy. And you get into all sorts of ethical issues that have to be weighed individually when you're talking about people who can't make their own decisions. And it's tricky. And I think that's, but the opposite side of that coin is, what would pregnancy do to that person who can't consent for or against, right? So that's a huge health risk in and of itself. What would it do to somebody who was mentally unable to make their own decisions and then all of a sudden had to go through a pregnancy those body changes giving birth, how do you explain that to somebody who won't actually understand or be able to understand what a pelvic exam is to have a pap smear done? I mean, that can be horrifically traumatizing. And so I think that in reproductive age, girls and women who are able to make their own decisions, but maybe under the influence of a parent or a foster parent or somebody, I have to default to that, even teenagers or that person's will. And if they absolutely refuse, and they might even say, I'm trying to get pregnant, then that's their right. Like, I'm not going to put an implant in somebody. I'm not going to put an IUD in somebody or give them a depot shot if they're trying to get pregnant, even though their foster parent doesn't want them to. And that's where that autonomy comes in. And yeah, that kind of sucks because I'm thinking that's probably not a good idea. But that's where autonomy comes in to play. Mentally, developmentally delayed. Right. Okay. Yeah. So you have to go with the caretaker, just like with any medical decision. Those who are unable to make their own decisions, the one with legal guardianship or authority makes them. And as long as it doesn't feel nefarious, right? I think that that's best to avoid pregnancy. You know, I don't think I would feel comfortable sterilizing those folks. I would give them a highly effective reversible method, like an IUD or an implant, or even a depot shot if they tolerate it and can come back. That's also a great thing that doesn't require them to, be mindful of taking a pill every day, or, it just depends on the individual. But yeah, no, and that's of note, important. Reproductive health is protected in the patient-doctor relationship. So minors seeking reproductive health care do not have to disclose to their parents. They do not need a parent's permission. And likewise, HIPAA applies. And so the healthcare provider cannot talk to the parents about those discussions, those tests, without the patient's consent. That's a thing that most teenagers don't know. It's a thing that most parents don't know. And a lot of healthcare providers come to think of it. So I just want to put that out there, that a teenager coming in for reproductive health care, specifically, again, reproductive health, so STI testing, anything doing with sexual health, birth control, that sort of thing, they do not need parental consent for those services, and they do not need to disclose to their parents, and the provider should not disclose information, just as you wouldn't disclose information with any other patient without their consent. So that's a thing. I think I'm going to leave it there. I didn't really get into barrier methods. I think, condoms, they're good. They protect against other STIs, not just unplanned pregnancy, but also bacteria and viruses. The other methods do not, by the way. Good to know. So always use condoms every time. You should be carrying, ladies, carry your own condoms. If you're having penis and vagina sex, you need to have a condom with you. It's not his responsibility. It's yours. No penises in the vagina without a condom. No penises anywhere else without a condom. I can get graphic, but I won't. I'm going to finish my tea, and I appreciate all of you for tuning in, and I'll see you next time. Bye.